I am Roger Colobran from Barcelona. I work in the Vall University Hospital, and I'm in charge of genetic diagnosis of primary immunodeficiencies, both at diagnostic context and in a research context. And I am also a professor of the Autonomous University of Barcelona. I was fascinated for immunology during my journey in the university. I did biology, and after the university, I started to do my PhD in a hospital. So since the beginning of my career, my research has been in a hospital context, so in a clinical context. And during my PhD, I was also fascinated about genetics. So finally, I tried to merge these two disciplines, both immunology and genetics. And now I'm doing this. So I am doing genetic diagnosis of primary immunodeficiency. And my main lines of research are studying this genetic basis of primary immunodeficiencies. I would tell to young immunologists or geneticists that always stay curious about science, about medicine, and it is important that they do not forget that behind a sample or a sequence or a DNA in genetics, there is a patient. So it is very important to have the clinical context of the patient to interpret the results, because the same result may be different in different patients. So it is very important the close collaboration with pediatricians in this case to integrate the results of immunology or genetics into the clinical context of the patient. My main interest in research is to expand the genetic and molecular basis of primary immunodeficiencies. So most of my projects are trying to find new genes, new genetics variant, explaining these primary immunodeficiencies, and also how to apply the most, let's say, cutting-edge technologies to improve the diagnosis of these patients. So finally, the clinical impact of my research lines is that we try to improve the genetic diagnosis. Obviously, this is good for the patients because a prompt diagnosis may lead to a better outcome, better treatment, and a more personalized approach to the patient. So the title of my presentation will be When to Suspect Genetic Susceptibility to Infection. And I would like to focus in some special situations, the not more obvious ones. There are situations in which a single infection that can be life-threatening or a repeated infection by a single pathogen may lead to this genetic suspicion. I will try to give some examples of these situations. I will try to explain the connection between this genetic defect and infection. And finally, I will try to briefly summarize which techniques we use to find the genetic defect, in order that pediatricians are aware about these situations and can apply this knowledge into its daily clinical practice. Collaboration between immunologists, genetics, pediatricians is essential, especially in complex conditions like primary immunodeficiencies or others. So each specialist has a unique perspective of the disease, and putting together all this perspective, obviously, it has an advantage to improve the care for the patient. So I think the EAPS Congress provides a platform for this interaction between professionals and to put together these different perspectives for the benefit of patients. What excites me more about this EAPS Congress is the opportunity to interact with these different specialties, pediatricians, in my case, immunologists or geneticists, and put together our views for improving the patient's care. In my case, I'm interested in learning more about the clinical features of these patients because I'm not a clinician, but I need to know the clinics of patients when I interpret the genetic results. So for me, it's very important to have a clear clinical perspective of the patients when I analyze the genetic data. My main message to the pediatric community is that don't forget to think in genetics, especially when you have atypical presentations, complex situations that may be explained by a genetic defect. In case of infections, infections are very common in population, and fortunately most of these infections are completely controlled by our immune system. But sometimes atypical presentations, severe infections in otherwise healthy patients may be caused by a genetic defect. So don't forget that genetics can be the explanation of some, obviously not all, but some of these situations.